Right. Hello, everyone. My name is Emily Muirhead, Development Manager with the Max Foundation, and I'm thrilled to welcome you all to today's first annual donor exclusive State of the Organization presentation. If you're here, it's because you're a generous supporter of the Max Foundation. So I first just want to start off by expressing some deep gratitude for all of your parts in helping fuel our mission. We truly couldn't do the work that we do and support the tens of thousands of patients that we serve every single year without people like yourselves. So thank you for being part of this global community that's helping us accelerate health equity every day, year round. So today you'll be hearing from a few members of the Max team, including our CEO and co-founder, Pat Garcia Gonzalez. We'll cover the story of the organization, highlights from our work in 2023, and of course, our biggest priorities for 2024. So before we really dig into it, just a few quick housekeeping reminders. We'll be leaving space for two different audience Q&A portions throughout the program. So please submit any questions you have for Pat using the chat feature throughout the webinar. A staff member is going to be monitoring the chat, so please let us know if there's any other issues that arise and we can get those addressed there. You'll notice that only the presenters will be on screen and with audio today, as we do have folks joining from around the world. So we're just hoping to ensure stable bandwidth. So we have to do some internet issues over here right now. If you'd like to turn on closed captioning for your personal viewing, you can do so by clicking that Start Captions button at the bottom center of your Zoom screen, and that can be toggled on or off at any point in time. And lastly, this presentation is of course being recorded and will be distributed to you all via email in the days ahead. So next up, I'd like to introduce our lovely Vice President of Development, Wilma Cominot, who's been with the organization for 4 years and counting. So Wilma, take it away.
Thanks, Emily. I too would like to welcome everyone and thank you for joining as well. Good morning, good afternoon, good evening, depending on where you are in the world. I want to give a special shout out to those that are joining us internationally. And of course, thanks to those joining in the US across all our time zones. So I want to take just a few minutes to the origins of the Max Foundation, which we fondly call and shorten by just using Max. So the organization is named after Max Rivarola, who was diagnosed with leukemia in 1988 when he was just 14 years old. His family was living in Argentina at the time, and they moved to the US to get a higher quality of care. And they also had hoped to get a bone marrow donor. So while waiting for the bone marrow donor, the family collected a lot of information about Max's leukemia. So this is reminder, this was in the late 80s. So this is pre-internet, pre-cell phone. And yes, there was a world before cell phones and the internet. And I know that there are a couple people on this call that grew up in a world where internet and cell phones, they were born with it. So the family had to gather information about Max's leukemia kind of in the old-fashioned way by calling calling doctors, doing research at libraries, talking to specialists, and gathering whatever information they could about Max's to save Max's life. Unfortunately, they were not able to find a bone marrow donor, and Max passed away in 1991 when he was just 17 years old. His family didn't want to waste all the effort that they put forth in gathering all this valuable information about Max's leukemia, and they wanted to share it with other families that were on a similar cancer journey. So the origins of the Max Foundation was actually a helpline. They opened a helpline to be able to share, again, all this info. Fast forward 27 years later, we are still helping patients, but in an even more impactful way. So thanks to you, we are providing life-extending medication to patients for as long as they need it, and we are providing patient support programs to help patients holistically. You'll hear more about your impact throughout this presentation. So as our organization evolves, we need to stay focused and are guided by our strategic plan. There are three main objectives. One is to treat more patients. We want to provide services to more patients around the world. We also want to amplify the voice of people diagnosed with cancer everywhere. We also want to sustain our work by ensuring that the organization is set up for growth. We're in the middle of this 5-year plan, And now our CEO will provide you with an update on how we did last year and our plans for this year. So without further ado, I'd like to introduce our CEO and co-founder, Pat Garcia Gonzalez. Take it away, Pat.
Thank you, Wilma, and good morning to everyone. And thank you so much for your interest in this webinar and for supporting our efforts. I'm really delighted to be here today to share some of our accomplishments of last year. You know, we have a strategic plan. We want to keep ourselves accountable and make sure that we are accomplishing the goals that Wilma just mentioned. Let's just next slide, please. So I am really proud of the work we've done in 2023, especially that we were able to provide services to 37,000 individual families living in more than 70 countries. And this is the highest number of individual patients we reached in any one-year period since we established the organization. So I'm really proud of this accomplishment. And just a little bit of information about these families. First of all our services are free of charge. A family will never receive a bill from the Max Foundation. Most of these families received the medication their loved one needed for their cancer. And one thing that Wilma just mentioned, but I just want to make sure that we understand, because it's such an important part of our model. It's like about 90% of families we helped this year, we had already helped in years before. You know, our model is very unique in that sense, that when we identify a patient and a family that needs help, we, to the extent possible, continue to provide services to that patient and that family for as long as they need it when there is no other way to access a medication. So in most cases, patients stay with us for many years and we continue to provide services. Next slide, please. One of the most impactful things we did in 2023 was, for the first time, we were able to reach women diagnosed with breast cancer. You know, we have such a long history of helping patients with leukemia because this is where our history comes from, and we have a very strong leukemia, especially for chronic myeloid leukemia, which was a type of leukemia Max had. But we knew that going into this strategic plan, there are many patients with other cancers that also need help. And breast cancer, of course, is one that everybody is aware of the impact around the world. So the particular medicines that we were able to provide to patients with breast cancer are the newest ones, because our vision is that it shouldn't matter where in the world you are, everyone should be able to receive the best medicines, not just medicines or old medicines, but the best and newest medicines. And so for the first time in 2023, women diagnosed with advanced breast cancer in Mozambique and in Nepal now have the medicine they need for their cancer. And, you know, these medicines, again, had never before been available in these countries, and really wouldn't be available if it wasn't for, you know, all of you that are supporting our efforts to reach these women. So I'm very pleased and very happy that we're able to do this for these families. Next slide, please. Now, if we think about it, one of the challenges of bringing these new medicines for a cancer that had never had treatment before is that because there was no treatment, there had never been a need to actually confirm a cancer diagnosis. So I think that many of us are familiar with breast cancer, for example. There's many types of breast cancer, and it requires very specialized testing. And so, you know, no one wants to ask a family to spend a lot of money to do some testing to be able to say later that there is no treatment. So, you know, when we start a program like this in a country, not only we have to figure out how to bring the medicines, but we have to work to strengthen the diagnosis. So in parallel to providing access to medicines, you know, for leukemia, we have been working for about 10 years in strengthening and bringing infrastructure so that the molecular diagnostics is there. And in 2023, we expanded our efforts to include the diagnosis of breast cancer. And we did a lot of training of pathologists, a lot of assessments. There's still a lot of work to be done, but we got ourselves started and provided diagnostics to more than 7,000 tests in about 40 countries in overall. Next slide, please. And unfortunately, many of us have had a cancer diagnosis in the family, and we're deeply aware, even in the best of circumstances, life becomes completely upside down, not only for the patient, but for the family. And so we're very aware that some of the families that we're helping with medicine have a really hard time affording the cost of, for example, transportation to the hospital. So, some families struggle to keep their children in school even. So some of our support, as Wilma was saying, is this holistic support around the family to make sure that the patient can successfully access their treatment. So we provide transportation grants, a lot of disease education and support, and even we provide schooling support to some families. And so in 2023, we were able to reach 3,000 families with these types of services. And one more slide, please, Emily. I think maybe all of you are thinking some of these challenges are not really unique to patients in developing countries. We know in the US that there's so much need. In the US, it's one of these situations where in paper, you would think that everybody can have access to the newest medicines. They're all approved here, and supposedly there's access. But we know, the system is so fragmented that is so difficult to navigate. And so, we are very, very happy that in 2023, we were able to launch a patient navigation program in the US. We started with the state of Washington, where we're based, but we're already learning quite a lot about, what are the needs people have and what are better ways that we can help in the future. So this is also, something that we did. We reestablished, sort of strengthened that original helpline that we had when we established the organization. So I guess, Emily, I'll stop here and give you an opportunity to ask me some questions.
Yeah, absolutely, Pat. Thanks for sharing that so far. So 2023 was clearly a year of major accomplishments for the Max Foundation. We've treated the highest number of patients than ever before in a single calendar year. We've launched a really exciting new treatment program and a new patient navigation program as well. But with lots of new accomplishments, especially of this caliber, this typically means there comes lots of learning opportunities. So could you share with us what were the most important lessons learned in 2023?
Yeah, thanks, Emily. Yes, we learn lessons every day. I learned a lot of lessons in 2023. I think at the end, I keep learning the same lesson over and over again, which is that success, at least for us, boils down to the same thing. The reason, we are able to do what I think other organizations think is impossible. The reason we're able to help anyone is because we seem to be able to attract individuals from all walks of life that take it upon themselves to step up and help others in whatever way they can. And so honestly, one of the biggest joys of my life over these years has been meeting so many of these people. And in 2023, I was able to travel to Kenya. I was very lucky to be able to go to Nairobi to meet with our partners. And, I took a lot of lessons from that visit. First, I was really impressed with the work that patient organizations are doing in Kenya. Not only in breast cancer, in leukemia, in a lot of the different cancers, they've organized themselves really well. by, a few patients that decide that they're going to help everyone and others. And not only they've done that, they're all really working very well together and being super smart at advocating to the government for universal health coverage. And they've made gains, they've been able to get the government to pass laws to provide services to patients. When I was there, they were hoping, the government is providing some basic cancer medicines, but it's not covering any of the diagnostics. So they were pushing for a new law, and they were able to pass this new law when I was there in October, so that the government now is going to also cover diagnostics. And I met Professor Otieno, who I had met in 2005. I had met him at a conference, and I had told him about this program we were starting. And I got a glimpse of what he did with that information. He went back to Kenya, he went back to Nairobi and his hospital. He convinced his hospital that they were going to organize this program and that they would not charge any patients for this work. And he's been going around for 20 years, convincing everyone in the country to help him. He organizes these clinics on Saturdays. He brings the junior physicians to volunteer, and the pharmacists are so involved, and the nurses and everyone. So that was just really, it was just really amazing to see it and understand it on the ground. And then of course I met with patients who told me their stories and their testimonials. And I just had the way that they all come together and support each other. In fact, in the last year, in 2023, we were able to decentralize the program in Kenya because, there's just a few cancer. We were working in this one cancer center before, and we thought that, it would be great if patients can have access to these medicines closer to their homes. But we're having a hard time convincing them. They rather travel because they have such sense of community at Nairobi Hospital. So, that's one example. I also, I was really happy in 2023. For the first time in 2023, we were able to help patients in Guinea and in the country of Guinea. And, it took all these years to find one hematologist that contacted us in 2022 who was willing to work with us and step up and help figure out all the parts that need to figure out to open this program anywhere. There's a lot of regulation on the use and shipment of medicines, so it's not just knowing how to treat patients. And so this hematologist really was such a champion. And by end of 2022, we had shipped medicines. They arrived on January 3rd of 2023. And on January 13th, the first patient was treated in Guinea. So again, it just takes that extra step that all of us have that opportunity in front of us to step up and help our community. And so those are the biggest lessons I learned.
Yeah, those are amazing stories. It's pretty incredible to hear stories like that because I think they really illustrate the whole continuum of the work of the Max Foundation, from a country that we have been running treatment in for about a year to a country we've worked in for over 20 years, but just seeing the spectrum of just kind-hearted, hardworking, problem-solving people across the world. I mean, that's incredible. So I'd next like to ask, what were some of the challenges last year that prevented progress for us?
Yeah, we think we can solve just about any problem, but there are things that are really beyond our control. As an example, we had worked so hard to bring our breast cancer drugs to Mozambique. And, I was just every day just wanted to know when they arrived to the hospital. And so we finally got the medicines to the hospital. We knew that there were 7 patients waiting for these medicines. So I was told medicines are at the hospital and I'm waiting. Okay, now every day they're going to tell me patients access treatment, started their treatment. But it just turned out there was some kind of political something unrest in the capital city of Maputo that day, and the government established a lockdown. And now for 7 days, we sat there waiting because women could not reach the hospital. So it took, that was a delay. So political instability is something that, it really is beyond our control. We've had a very, very difficult situation in Sudan last year. I don't know if sometimes we pay attention to, what's happening in the world, but at the beginning of 2023, a war started in Sudan, and we lost be able to talk to anyone in the hospital. And we have not been able to reestablish that program in Sudan. And even there's a region of Armenia where we haven't been able to access, to reach patients because of that. So war and political instability are things that we deal with every day and are very hard. Another one that is not so intuitive is climate change. How's climate change affecting our program? The extreme temperatures are making it harder for us to ship medicines in stable condition. And so we see more and more that shipping routes that before we could ship medicines without sort of extra care and packaging, now we have to do more expensive packaging to prevent, and one thing is this is happening, I don't know, in some region of the world, but some of the temperature excursions that we see in our medicines are happening where the FedEx truck is picking up the drug in like North Carolina, and it's unusually cold in North Carolina, and so the FedEx truck is not able to maintain the temperature. So that's another one that we see. We have to pay attention how it's affecting our work. And I'll tell you the last one, which is the one that keeps me up at night. There were 2 women in Mozambique diagnosed with a type of breast cancer that could use these medicines, and but these medicines are work for women past their menopause. And these 2 women were too young. They were in their 30s. And so if you're in your 30s, you need another third medicine to do the combination. And we don't have yet access to that medicine. And these 2 women passed away because they were too young to be able to receive the treatment. So, that still haunts me. And I really hope that we're going to change that in the future for other women.
Yeah, absolutely. Well, thank you for sharing those stories. I feel like they're simultaneously heartbreaking and heartwarming to kind of see how we're addressing some of these different global issues that come up. And, being an organization that works in 77 and growing countries, it's just inevitable that unforeseen circumstances are going to occur. But I think the highlight for me is that Max always takes such an innovative approach to everything that we do, and any regional or country specific problem that arises, we are dedicated to figuring it out. We don't just drop it and run. We really are dedicated to finding a solution. So that's amazing. So I now would like to turn it over to the first portion of the audience Q&A. So I did want to first address some of the questions we had submitted during the registration process. So first up, we do have a question from Robin. They would like to know, how do you choose the partners that Max works with, and how do you monitor their operations?
Yeah, a little bit I have mentioned, right? So when we go into a country, and we, first try to get the lay of the land to figure out, we look for the public cancer hospital. And in most countries, we are working with the sort of the National Cancer Institute, National Cancer Center. And then we have to have a physician, an oncologist, or a hematologist in this hospital that's willing to do what the physician in Guinea did, which is really helping us be that champion that helps overcome all the regulatory hurdles that we have to overcome. Then we have to figure out, make sure that if physicians need training, if they have not treated this type of cancer before, we facilitate the training, and then establishing sort of a supply chain into the hospital, which is another very regulated environment. So, there's many steps that go into that. So we work with public hospitals in general, and we are in contact with these physicians every day, multiple times a day. We have our own system that physicians log in to give us information about their patients every day. We collect a lot of documentation in terms of, their inventory, dispensing logs, so that we know when every patient receives the medicine actually. And so we're in constant contact, and then as much as we can, we do site visits like we did last year to a few countries, and most, not only to monitor the program, but to try to find out what are the things that are really challenging on the ground that we don't see from here, and how can we help them better.
Yeah, absolutely. And then our next question is from Mika. What are the most positive things that happened at the Max Foundation last year or among the patients that we served?
Yeah, I mean, I think I've told some of these stories. I can tell stories all day long. There was a patient in Mexico. Mexico in general, we think Mexico is a little bit more developed maybe than some of the other countries, and that people, we all go to Mexico on vacation, and we think that there's infrastructure, but there's regions in Mexico that are very under-resourced, and Chiapas is one of those states that is very under-resourced. And we were helping a few patients in this state, but there was no way to monitor their treatment, no way to do any kind of testing. So there's one patient who wanted to get himself tested, not only decided that he would work with our team to figure out what we could do, but he decided he was also going to help all the other patients. So, he got them all organized. I mean, he just organized his whole community, and then with the help with the Hutch here in Seattle, the Fred Hutch Cancer Center, we were able to ship the samples to the Hutch to get everybody tested. So, it's those stories of just courage and stepping up that I think that is what keeps me hopeful and optimistic about the future.
Yeah, I agree. That's a beautiful story. Yeah. All right. So our next question is from Rob. What have been the biggest barriers to Max securing donors for medicines and funds to support its programs?
The biggest barriers are, first of all, trying to convince people, first we have to convince them that it is possible to do what we do. These people think it's not possible, and we have to show them, yes, it's possible. They also think it's not necessary, right? There's no need. There's no need in these countries. Cancer is not a priority. Well, when your family member has cancer, it's a crisis. It's a humanitarian crisis at the family level. And so first, explaining that there's a need. Second, explaining that it's possible. Overcoming all we have to minimize the risk. I mean, we do ask a lot from our corporate donors. We ask them, they get their new medicine approved in the US, and they say, this is their biggest asset that they have. And then we ask them, like, okay, now give it to us and trust us that we're going to take care of it, and it's not going to go in the black market, and it's not going to be misused, and we promise you that we're going to do so. There's a lot of conversations for us to show them that our system is solid and that we really know how to do this. But it just takes longer than I want to. And and then there's, there's no business reason to do this. This is really a humanitarian, I call it a humanitarian pact. Like, it's because it's what we should do. So those are some of the biggest hurdles that we have, and we're not giving up on that one.
Never given up. All right, so I think we probably have time for one more question during this section. So the question is anonymous. Will Max GPS eventually provide cancer medication in addition to patient navigation services to patients in the United States?
That's a really great question. If you ask me, I hope so. I know some of my colleagues, if they hear me say that, and they're a little bit freaked out probably, because it's complicated. They will say, I have told one of my colleagues that every time he says it's complicated, I told him, never say that to me. Like, if we're gonna not do something because it's complicated, then we shut down the organization. Everything is complicated. That's not a reason not to do something. We are assessing. We are working with, looking at the regulatory environment and how could we do this in the US. That would be a dream for me, to be able to do that.
Okay, fantastic. Me as well. So this does conclude our first Q&A session. So thank you to everyone who has submitted questions thus far. Please do keep submitting them in the chat throughout the rest of the program, as we will have that second opportunity a little bit later on. So Pat, we've just heard a lot about what we've accomplished, learned, and overcame in 2023. So can you tell us, what can we expect for 2024?
Yes, thank you, Emily. I will tell you some of our plans for 2024. Of course, we're continue to be ambitious and audacious is what I say that we are. Can I have the next slide? Basically, you can summarize our plans for 2024 in the word more. We want to help more patients. This year we were able to help the highest number of individual families. We want to continue to grow that next year. Very specifically, we reached women in 2 countries in 2023 with breast cancer medicine. We want to reach women in 10 more countries this year. And I can give you a breaking news that already we were able to help the first patient in Cambodia. And yesterday I learned also in Bahamas. So, little by little, we are reaching more women in more countries with breast cancer treatment. And that's going to be, something that I hope we will be able to share as we go in the year, more and more of that. We also have there's a new drug for a different type of leukemia, lymphocytic leukemia, different than Max's leukemia, that just came out. That's it looks really great for patients, very high impact for the disease. And we are partnering with a company. So we are waiting any day for the first patient to be treated with that medicine. I think it's going to be in Armenia. And, we're really looking forward to growing this new program for this chronic lymphocytic leukemia this year in 2024. And there's also a very new medicine for the type of leukemia Max had, which also we are really wanting to bring to more countries this year. So more countries, new drugs, more families. We also, I really would want to say that we will have access to that drug that young women need to be able to be treated for advanced breast cancer. And I will be working really hard to make that happen. I hope that in next year when we're doing this, I'm telling you that it happened, but I hope I will be able to share with everyone earlier than that, because that's a tragedy that should not happen again. we will expand our investment in diagnostics, like any of these areas. If we stop everything we were doing and we concentrated on breast cancer, for example, we have, more work than we could possibly do. If we stopped everything and concentrated on diagnostics also, the diagnostic barrier is huge. So we will expand our investment in diagnostics, and we're hoping to go from 7,000 diagnostics to 10,000 next year. We will we hope to provide more transportation grants. We hope to help more children with even with schooling. The schooling thing is not not so not something we think about so much, but it's so important, when there's a cancer diagnosis and there's a crisis in the family, and that family decides that they don't have the resources to keep the child in school. The tragedy of that is that no matter what happens to the parent, if they leave or not, that child that doesn't get educated, that changes their life forever. So, a little bit of help keeps that child in school. So that's really important. Okay, next slide. So I have shared so much about challenges and complicated things and complicated situations that need a lot of thinking. So there are so many of you and so many experts and people that have come to us to want to be part of our organization and share their expertise. So we are very, very excited to be launching what we call Max Think Tank. I was listening yesterday to some podcast that was talking about think tanks, as this esoteric group of people that sit down and think of policy. Well, our think tank is the opposite of that. It's a group of people that want to find practical solutions to real life problems that are stopping us from reaching more patients. So we're excited to be launching it in March, and that's something that I think will help us sort of accelerate our growth and our impact. And next slide, please. So we hope to have at least one more corporate partner to provide medicines to us. I really hope it's one of the ones that has this medicine that we need. But we have other diseases also that we're pursuing some partnerships. And everything that we do, I mean, I think is pretty large, the scope of our programs that we're able to help 37,000 individual families. We do with less than 100 sort of team members all over the world. And for the first time in 2024, I think we're going to reach the 100 mark, that our team will be, I think, 101 if we are able to sort of expand the team. Most of our team members are in the countries where we're working. About 70% of our team is from and in the countries where we work. So that's sort of very important, and important for all of you. You will see sometime a new website, and we're always trying to improve our sort of that goal that we have of amplifying the voice of the patients. And so I will expect that you all will tell us if you feel that we're doing better in social media and in our communications, to make sure that the world sees these human beings that are just like all of us, except they're like in a place where for whatever reason they cannot access the medicine they need. So that's really important to us.
Yeah, definitely.
So back to you, Emily.
Well, thanks for sharing all that, Pat. I, for one, am very excited to see all of that come to fruition this year and to hopefully have 99 colleagues for the first time. So as promised, we do now have some extra time to go into some additional audience questions for you. So the first one is from Ellen. Can you please expand upon the pathologist training? Who do you partner with for such trainings?
Yes, thank you. We are working closely with the American Society of Clinical Pathology, who are, very dedicated to sort of twin with pathologists in other countries, and help them develop sort of strong infrastructure in their hospitals. We also are working with companies that have reagents for the testing that we need. So we work with them. And then there's a consortium of organizations that led by the Union for International Cancer Control, that's called the ATOM Coalition, the Access to Oncology Medicines. And so we're working very closely with them to be able to slowly make progress in bringing up the pathology in some of these hospitals. So we're welcoming any partner that's wants and willing to join us. We discovered it's hard to find out sometimes what is the problem, right? And so in breast cancer, apparently, to do the biopsy, you need like a very specific type of needle that only one company makes, and it's very expensive. And so part of the whole problem is that these samples, when they're doing the biopsies, the samples don't get done in the best way possible. So we've reached out to that company, and we are hoping also that they will come on board and provide these needles. So there's all those tiny little pieces that are so difficult to find out exactly where the problem is. And so we're putting together this sort of expanded humanitarian pact. So everyone that feels that they have something that can help us, please let us know, and we'll be so happy to partner with you.
You can't tell we're big on partnerships at the Max Foundation.
Nobody
Okay,
can
so our
do
next
this-
question.
Nobody can do this alone. Nobody
Yeah.
can do this alone.
That's right. Okay, so our next question is relating to Max GPS. So Jerry asked, what programs in 2024 are you involved with in the rural US? And I know you've sort of talked about the launch of Max GPS thus far. So maybe you could speak a little bit more about our community outreach efforts, the types of populations that we're going to be targeting with that program.
Yeah, typically the hardest to help. And it's interesting to me, because when we started the Max Foundation, one of the biggest sort of philosophical aspects that we thought, we never want to compete with any organization. We don't think NGOs should be competing with each other. So we want to help those that no one else is helping. And I assumed that, in the US, you have American Cancer Society, Leukemia and Lymphoma Society, you have these huge organizations. And so I thought, well, they are providing services, I don't want to compete with them. Well, it turns out they refer to us all the difficult cases. So of course, refugees, people that fall through the cracks of the system, that don't have a way to access medicine. So, some of the tribes, some of the immigrant communities. This is something that in my mind, because we have such, our team is so diverse, and I think we speak together about 40 languages. So, even that, being able to provide that sort of cultural and language specific support is something that we're trying to specialize. We're trying to always make sure we're not doing something somebody else can do. And so it's those other cases that come to us. And of course, the hardest to find solutions for, but working together, I think we can help those families.
Yeah, absolutely. I'm excited to see how that program grows for sure. So one of our other questions is, what countries does Max plan to expand into next? A big question.
Yes, there are still countries after 27 years, or after, all these years that we have been working, there are still countries where we haven't been able to find a partner. that is able to work with us, really for lack of resources. So this is the least resourced places in the world. And also, I always say the world is a very big place. There's all these tiny islands with people that also get diagnosed with cancer. Then, maybe because a few years ago, we found patients in Vanuatu, a place I had never heard of, Vanuatu, but now we are aware of a 28-year-old young woman in Grenada. I had never also thought about Grenada. So we're trying to open a program in this tiny island in the Caribbean of Grenada. There's a few countries, especially in sub-Saharan Africa, and so we're working to establish a program in Burundi. We're working to establish a program in Swaziland. So we still have places in the world where today you have nothing. So we continue to do that. So keep those countries in mind and ask me next year how we're doing.
Will do. So then we have Klaus asking, do you have representatives in all countries and regions that we work in? And I know you previously mentioned that about, I think 70% of our staff is outside of the United States, but any other details, welcome there.
Yes, thank you for that question. No, we don't have team members in every country. We have physician partners, obviously, in every country. We have more than 500 physician partners, and we have team members, I think, is in about 25 countries. So how do we decide where to put team members? Now, if we had the resources, we would have a team member in every single country. So in those where the programs are a little bit bigger, then we bring a team member to support the hospital. But in the other countries, our main partner is the hospital, the physicians, the pharmacists, and the nurses in that country.
Okay, fantastic. And somewhat similar for the next question, are there any new disease treatment areas on the horizon? So we've just had advanced breast cancer, just had CLL. Are there any big targets that we have?
One disease area that I have in mind is multiple myeloma. There's not only, it's a very difficult disease. There are good treatments. Their treatments are a little complicated, but there are good treatments. So I have in mind that's sort of the next disease I would like to go into. There's a lot to do in breast cancer. There's a lot more medicines, a lot more types of breast cancer. So, that's going to be a big focus of our work in the next year.
Mm-hmm. Very exciting. Okay, so I think time check, we probably have time for just one more question here to wrap up the Q&A. So another anonymous question. Do you provide diagnostic support to healthcare partners for as long as they need, similar to how medication is provided to patients for how long as they need?
Yeah. We are growing our diagnostics program as we grow our resources, and a lot of our resources go to fund diagnostics. And so for the countries where we're providing diagnostics, as long as we have the resources available, we continue to provide the diagnostics because, at the beginning, we were providing just the one-time donation of diagnostics. And what was happening is the physicians were hoarding these supplies we were sending them, not really using them properly because they were so special. And so, they were so worried that they would not have any more, that they were testing patients too late. And so we realized if we really want to make a difference, we have to promise to this center that we will provide access to all the diagnostics that they need. Obviously, all our work is meant to be a bridge until the government is ready to fund all this, even the treatment and the diagnostics. So slowly also we are, starting conversations with the ministries of health and ministries of finance. And as countries develop and as countries develop cancer plans, then, the hope is that, as we have seen in the past 20 years, many years ago, we were working in countries where we're not working anymore, like Thailand or Vietnam or China, where, 20 years ago, there was a lot of need, but now the government is providing access to these treatments. So, working in parallel in all these sort of different lanes.
Yeah, absolutely. I'm glad you brought up that last point about how we sort of transition out of certain countries and situations when they have the infrastructure in place to do essentially what we were doing. It's a really insightful point. All right, well, thank you, Pat, for answering all of those questions. And thank you for everyone who has submitted them thus far. That's all we have time for on that front. If we were not able to get to one of your questions today, or you think of a follow-up at any time, please feel free to email us at fundraising@themaxfoundation.org, which will also be dropped in the chat soon, and we'd be happy to answer any questions that come up. Okay, so now I would like to invite Wilma back on to share a bit more about how this community can engage further with the Max Foundation after this call today.
Sure. Thanks, Emily. And speaking of engagements, those were very insightful questions. So thank you for engaging with us. So we look forward to your continued support so we can help more patients. The emphasis, as Pat had mentioned earlier, the emphasis is on more patients. So other ways you can join us is help us think through our challenges. Join our think tank that Pat had mentioned earlier today. Help us amplify our voice, share our stories, follow us on social media. And also, Pat briefly mentioned the site visits. So you're more than welcome to join us on the site visits to one of our partner hospitals where you can meet the physicians as well as the patients. Also, if you don't already receive our newsletter, please subscribe by going to our website. In order to keep you, our valued supporter, better informed of our progress, we're going to be hosting several webinars throughout the year. So our next one is scheduled for April, and it'll feature one of our regional colleagues from Latin America. So please look for an email next month. And then finally, we would love to see all of you in person at our upcoming gala on March 23rd. That I'm going to have it go back to Emily to close this out.
Yeah. And myself, Wilma, Pat, we're all going to be there in person at the gala. So if you're able to attend, please come say hi. We love to see people face to face. And lastly, I just wanted to provide one last big thank you for everyone's time and attention on today's webinar and for your ongoing support of the Max Foundation in whatever form that takes. Our partners and supporters like you all are really the driving force behind our ability to expand our programs, go into new disease treatment areas, and continually reach more patients and help their families. So your support is invaluable, and we just thank you so much for being part of this global effort. So with that, we are going to wrap up this webinar and make sure we get out of here on time today. So I hope everyone has a fantastic rest of their week and weekend. And thank you so much for joining. It's good to see everyone.
Thanks, everyone.
Thank you. See you soon.